Dandruff. Dandruff, a harmless and chronic condition, occurs when the scalp is dry or oily and produces thin strips of dead skin. These small white scales dot the hair and fall like snow on the shoulders. Although harmless, dandruff can be bothersome. They often appear between the ages of 10 and 20 and affect up to 40% of people over 30. Causes. Skin cells are continually forming on the scalp. Shedding of dead skin cells is therefore a normal process. However, when you have dandruff, the desquamation is sometimes accelerated. The oil present on the scalp causes these cells to clump together, giving them the appearance of white flakes. Dandruff can be caused by several factors, including dry skin, hypersensitivity to hair treatment products, and certain conditions like seborrheic dermatitis and eczema. Overgrowth of yeast-like fungi can cause dandruff. This phenomenon can be caused by stress, hormonal levels, the presence of too much oil on the scalp, or problems with the immune system. Symptoms and complications. Dandruff appears as white flakes in the hair and on the shoulders. They are accompanied by itching, redness and scaling on the scalp. Dandruff scales are usually scattered all over the scalp. If dandruff is caused by seborrheic dermatitis, symptoms usually appear gradually. The scalp becomes dry or greasy, reddened and itchy. When skin cells die, they form yellowish flakes. Severe cases of seborrheic dermatitis can lead to symptoms appearing in other parts of the body. Yellowish or reddish scales may appear at the hairline, in and around the ears, or on the nose or trunk. Newborn babies with this condition present with a yellowish, thick, crusty scalp, called cradle cap or strangles. Diagnostic. The diagnosis of dandruff is easy to do yourself. The scalp itches, it is dry and strewn with scales. Seborrheic dermatitis is accompanied by reddish skin, a few yellowish and greasy scales and plaques with indefinite outlines. Treatment and prevention. Although often chronic, dandruff can be treated. Try a non-medicated shampoo first, massaging the scalp vigorously and rinsing well. Frequent application of shampoo removes scales, reduces the amount of oil and prevents the accumulation of dead skin cells. If there is no improvement, special anti-dandruff shampoos can give good results. The method of use depends on the shampoo used. Some are for daily use, while others are for once or twice a week. When choosing an over-the-counter shampoo, look for anti-dandruff agents such as ketoconazole, selenium sulfide, salicylic acid, sulfide, tar or zinc pyrithione. You may need to experiment a bit before you find the right one for you. If over-the-counter preparations do not improve your condition after 2 weeks or if symptoms worsen, consider medical consultation. The doctor may prescribe a corticosteroid lotion, which can be applied to the scalp. Never use corticosteroids for a long time without consulting the doctor. They can thin the skin and cause other undesirable effects. For infant cradle cap, apply a small amount of mineral oil to dry areas of the scalp to soften the patches. Remove plaques by gently brushing the child's hair and then washing the child's hair with a mild baby shampoo. If these measures are insufficient, try applying a small amount of lukewarm mineral oil at bedtime, then washing off upon waking. If these methods are not effective, see a doctor. In general, shampoos and lotions containing corticosteroids are not used for infants, because they absorb them through the skin much more easily than adults. Fortunately, the cradle cap eventually disappears spontaneously, without treatment, during the baby's first year of life. To help control dandruff, wash your hair frequently, reduce your stress levels, try to reduce the amount of products you put in your hair, e.g. gels and sprays, or stop using them altogether, and follow a balanced diet.